What bacteria is the leading cause of meningitis in adults? And that is D, Streptococcus pneumoniae. What bacteria is the leading cause of bacterial meningitis in newborns? And that is B, Streptococcus acinetobacteria. Now we're going to discuss botulism. The learner will be able to define botulism. The learner will be able to provide manifestations of botulism. The learner will explain the causes of botulism. The learner will know the effects of botulism on the body. The learner will also know how to prevent botulism. What is botulism? Botulism is not an infection, but instead an intoxication caused by a toxin of Clostridium botulinum that adversely affects synapses of the peripheral nervous system. Botulism toxins is one of the more powerful natural poisons. Manifestations of botulism. Clinicians recognize 3 manifestations of botulism: foodborne botulism, infant botulism, and wound botulism. All 3 are rare. Foodborne botulism. Patients with foodborne botulism become weak and dizzy 1 to 2 days following consumption of botulism toxins in contaminated food, which may or may not appear or smell spoiled. Blurred vision with fixed dilated pupils, dry mouth, constipation, nausea, vomiting, and abdominal pain are also seen. Percussion paralysis of all voluntary muscles then begins on both sides of the body as peripheral nerves are affected. Death may occur, or the patient will slowly recover over a course of months or years. Infant botulism. In this disease of infants who are usually under 6 months of age, in this disease, the bacterium actually grows in the child's intestinal tract where it secretes toxin. Infant botulism is characterized by nonspecific symptoms: crying, constipation, and failure to thrive. Wound botulism involves growth of the bacterium in dead tissues following introduction of endospores into wounds. Signs and symptoms are similar of these of the foodborne disease, but the incubation period is longer, 4 days or more.
So now we're going to show you a video of an infant that contracted botulism.
When she was the epitome of health, by the end of the day, a baby girl was near death. The doctor's diagnosis, a frightening alert for every parent.
Hey, sweetheart. She was having a hard time sucking and swallowing.
Carrie Hinkle first thought her 5-month-old daughter, Kiona, was just suffering from a cold because she didn't have a fever. By the end of the day, Kiona was looking very limp and listless.
I was worried.
So Brian and Carrie took her to the doctor.
Well, they sent us to the ER, and that's where she stopped breathing.
Kiona was immediately intubated and airlifted to Rocky Mountain Hospital for Children, and no one knew what was wrong.
Shock, horror, you know. Excuse me. Yeah, you can't prepare for it.
Doctors determined Kiona had infant botulism.
If it's not caught early on, she could have quit breathing at home and she could have died from this.
When they first mentioned the idea that it could be botulism, we were kind of floored.
Infant botulism is very rare. It can be caused when a baby eats honey or simply inhales dust particles that are contaminated with the bacteria. Carrie and Brian still aren't sure exactly how Kiona got sick. Doctors expect a full recovery, although it may still be a few weeks before this brave little girl gets to come home.
Whenever I come home from work, she gets this huge smile on her face. And I really miss that. So I can't wait until she does it again.
You know, on average, only about 85 babies get infant botulism each year in the U.S. To treat Kiona, doctors used a special immune globulin that they had to get from a clinic in California.
What causes botulism? C. Botulinum, the bacterium that produces botulism toxin, is an anaerobic, endospore-forming, gram-positive bacillus common in soil and water worldwide. Different strains of botulinum produce one of 7 antigenetically distinct botulism neurotoxins, toxins that affect neurons. Scientists consider botulism toxin the deadliest toxins known. 30 grams of pure toxin would be enough to kill every person in the United States. How does botulism toxin affect the nervous system? Botulism toxin acts by binding irreversibly to neuronal cytoplasmic membranes, thereby preventing the fusion of vesicles and the secretion of acetylcholine into the synaptic cleft. Botulism neurotoxins prevent muscular contraction, resulting in a flaccid paralysis. Once bound to the neuronal cell membrane, botulism toxin is never released. The synapse is forever blocked, and botulism may progress despite aggressive medical care. In this picture, A is the normal function of a neuromuscular junction. A nerve impulse from the central nervous system causes vesicles filled with acetylcholine to fuse with the neuron's cytoplasmic membrane. In picture B, botulism toxins block the fusion of acetylcholine vesicles with the neuron's cytoplasmic membrane, thereby preventing secretion of acetylcholine into the cleft. As a result, the muscle cells do not contract. How do doctors diagnose and treat botulism? The symptoms of botulism are diagnostic. Culturing the organism from contaminated food, from feces, or from the patient's wound confirms the diagnosis. Further, toxin activity may be detected by using a mouse biopsy. Using 2 mice, if the mice receiving the antitoxin survive while the other mice die, botulism is confirmed. Treatment of botulism entails 3 approaches. Repeated washing of the intestinal tract to remove Clostridium, administration of botulism immunoglobulin intravenously, and administration of antimicrobial drugs to kill the bacterium in infant and wound botulism cases. How can you prevent botulism? Foodborne botulism is prevented by destroying all endospores in contaminated food through proper canning techniques. Because infant botulism is often associated with the consumption of honey, pediatricians advise parents not to feed honey to infants until their intestinal microbiota are sufficiently developed to inhibit the germination of seed botulinum endospores, usually after 1 year of age. The questions for botulism are, which of the following are one of the types of botulism? And the answer is all of the above: foodborne, wounds, and infants. What is a foodborne illness caused by pathogens? The answer is infections. In infant botulism, the bacterium grows in a child's intestinal tract, where it secretes toxins. And that is true. How many gram stains of pure toxin would it take to kill every person in the United States? And the answer is 30 grams. About how many cases of foodborne or wound botulism occurs in the United States each year? 50. I didn't have that one on.